Then if you analyze, if you approach this to Sri Lanka, if you heard in the morning, this is the second largest foreign income revenue generation to this country, and he talked in billions. It's 7 to 10 billions in Sri Lanka, US dollars, generated through employing our unskilled labor in Middle East. But provided, think about if you employ the technical and the professional people, the potential will be at least not double, but it may be 6 or 7 times better than this. So the potential is enormous. But this is our position. You can see these figures. Now the professional employing outside is only 0.44 when 60% are employed as unskilled laborers. The transition should take place, and the young people here should look forward to do this transition in time to come. So therefore, whatever the outcomes, as Indika pointed out, in the international or global arena will have to be aimed at, not just to satisfy what is the obligations we are going to locally provide. This is where the concept was basically looked at, which I drafted and compiled with the Presidential Secretariat, Mr. Lalit Veeratunga, Dr. P.B. Jayasundar, and some other high-ranking officials. So basically, this is the situation. This is the improvement up to 2012. Still, it is 1.456% cannot employ when Sri Lanka is having this kind of, and this is unskilled labor exportation has its own problems. I am not going to elaborate because of the time constraints, the social problems you might encounter, and the economical problems I spoke to you just a moment ago, and then the family unit, which we are very concerned as pediatricians, and we see those things. And I am going to start actually a campaign very soon of family hour, because there are certain other technological elements are disturbing our family, and the kids have to go to school to perform or show their tasks, because the parents are always watching the television or they are disturbed with their cell phones and other things. So I think we have to address from a point of view from the child abuse, NCD, everything. The capacity building should be very cost effective way of addressing and putting the family into track is very important, whether you are rich or poor. And we are not good examples as doctors, so we have to at least tell what is good. And there are certain other consequences. So you might have seen this is nothing new for you, and what consequences that can lead to. But our potential, if you analyze, the free education is being given, and the countries with high literacy, we should not, I am not critical about the context, I am talking about a transition which we need to do. And then the IT literacy is going up. According to the government figures, by 2016 it is going to be above 50%. Currently it is around 30-35%. And the enthusiasm of families on education, that is our Asian kind of perspective, and the English literacy and the English education here. And we all have internationally recognized qualification. Despite that, we are going to confine ourselves here. And we are very rich in human resources, and we have a very liberal economy. So what we did is we actually conceptualized this, and this is a concept booklet. We published this. If anybody wants a soft copy, that will be available in the gma.lk website, this booklet, and it's as open source. And we established the Foreign Placement Coordinating Center to look after this interest. And not only doctors, this talks about even the nurses. So this booklet was published, and then we are trying to get this transition of unskilled labor going down, and it is going to be skilled labor, and the skilled people, after generating that revenue, to come to this country and employ our people as housemaid or drivers or otherwise. So then they will be better looked after, and they will be with their families as well. This is the transition we are looking at from a very policy and broad perspective. So what we had done was we tried our level best to help in arranging the foreign placement. And interestingly, people call it a scholarship program, sir. I wrote a submission to Dr. P.B. Jayasundar. If you talk about the scholarship program, always the treasury will look at from a point that is a revenue loss for there will be knowledge and other things gained, but the money-wise it's lost. But our foreign training program for doctors is a revenue generating program. The first year you may go on a scholarship, but the second year you start earning. They are given 2 years leave. So similar system should be incorporated into other sectors. That is what we have pointed out to the treasury. And encourage doctors to get more qualifications, then enabling. Now, to be honest with you, I am getting patients even from UK and from Germany, sir. Unusual, I don't know, probably because of my Eisenhower fellowship, my things are in the web. So that transition is taking place, and most of the Maldivian patients are coming to us because we carry qualifications which are compatible with what they want. And knowledge economy wise, if you take a radiology, that kind of a subject where you need not to be physically present in one place, you can, with technology, you can report from various other places. Those are the levels the India and other countries have gone up, and this will have a better way of address the future unemployment. We should not have skilled people unemploying and shouting on roads asking for jobs with their kids carrying, and this is a very unpleasant thing which I don't want to see. I think we should not see in future. They should be, and there is a controversial thing with whether it will have a positive impact or negative impact on the brain drain. I have argued on a way it will have a positive impact on the brain drain, because rather than we are losing them forever, why not we lose them for a short period? And if you can really position in Middle East like countries where you have experience, they will definitely return back after earning some money to look after themselves. And most importantly, we have to admit the fact, attitudes wise, as you pointed out and he pointed out, the communication skills, and I'm happy to say and to announce that we have started a Tamil language training program in Sri Lanka, and we have trained about 2,000 doctors by now, and it's fascinating, sir. They are talking in Tamil to Tamil patients. I had a personal experience this week itself, and it was very, very humanly, and very, very doctor-patient relationship is going up. So the attitudes. Then the collaborations, either research or clinical collaborations, mutual exchange programs, so on and so forth. So to coordinate this, everybody, all relevant people were connected, and ultimately we introduced this, and it was accepted by the government, His Excellency the President. This is the minute of that meeting, and this is how he had read out in way back in 2007 when I was the secretary to the association. And then this is how he read out in the budget. So the government approval is already there. He's not only talking about the doctors, but he's talking about the doctors, nurses, physiotherapists, everybody. It's a matter of how we are going to manipulate it. And now currently the FPCC is physically situated in National Hospital in a room, and we are working, and there is a governing principles. I am not going to details, and we are facilitating rather than just arranging placements, facilitating various other, say, portfolio, CV writing. Most of our doctors have the opportunity of getting the government employment straight away, so they don't carry CVs. So to write down a CV at the age of 40 is again another struggle. And then you see the deficiencies there, how to improve it. And the portfolio, to be honest with you, with this system where I went to Oxford, my boss asked me to bring the portfolio with me. I didn't know what a portfolio was. Then I asked what, and he was really sympathetic. So when I returned back with Indika and Gominda, we have started a lot of workshops to conduct, and we are writing a small hand booklet on how to maintain a portfolio. These are the things we should encourage in the next generation. And the sabbatical leave, I'm not going to detail, for the government doctors in order to place them either in the private sector or in the foreign employment. And the exchange programs. Now I am getting trainees from Mayo clinics, pediatric neurologists. Recently also I had one person, and interestingly the cultural integration is such that Dr. Kennedy Daniels, who came here, stayed here with me for 1 month. So he became a Buddhist at the end of the 1 month, and he worshipped me and went. So it's unusual experience, and that kind of, and now he's going to collaborate on our headache clinics and epilepsy clinic, all in the Mayo clinics, which is the basically center of excellence even in USA. So, and information and promotion. So anyway, these are the things we did. So what is next is, I think the innovative thinking should go, because all of the audience, the younger people have more neurons than us, obviously, and you all should be thinking very innovatively on these lines. You should not be inside the box. You have to go out of the box, but to think out of the box, we have to know what is inside the box. That's a very important principle which I learned from the Steve Jobs biography. You have to know the inside the box. People try to think out of the box, then you become a fool sometimes if you don't know what is inside the box. So anyway, and there is a leadership gap. I think that those are the way forwards, and you all are good people in leadership generating. So why not you go ahead? Thank you very much, and I'm again thanking you. And the outcome will have to be generated through your activities, through innovations and leadership. Thank you very much.
Thank you, Anuruddha.